Eileen Veilleux The Fam here. Welcome to a new installment in our mini mental health series. And in this installment, we are going to be covering bulimia nervosa, otherwise is commonly known as bulimia. Before we begin though, let me just remind you to please watch the full video because there's going to be 3 keywords throughout the video. When I get to the keyword, I will say keyword and then what the keyword is. At the end of the video, in the comment section, along with a genuine comment about the video, put in what the 3 keywords are to be eligible for a free merch giveaway when I reach 2,000 subscribers. So let's get started. What is bulimia nervosa? Well, bulimia nervosa, commonly called bulimia, is a seriously, potentially life-threatening eating disorder. People with bulimia may secretly, keyword, binge eating large amounts of food with the loss of control over the eating, and then purge. Try to get rid of the extra calories in an unhealthy way. To get rid of calories and prevent weight gain, people with bulimia may use different methods. For an example, they may regularly self-induce vomiting or misuse laxatives, weight loss supplements, diuretics, or enzymes after binging. Or they may use other ways to rid themselves of the calories and prevent weight gain, such as fasting, strict dieting, or excessive exercise. If you know somebody that has bulimia, they're probably preoccupied with their weight and body shape. They may judge themselves severely and harshly for their self-perceived flaws because it's related to self-image and it's not just about food. Bulimia can be hard to overcome, but effective treatment can help people feel better about themselves, adopt healthier eating patterns, and reverse serious complications. Now, if any of them, before we continue, just let me state, if any of them things sounds like you, please seek out medical attention because as we go on, you will learn there is a lot that bulimia can do to the body. It's just as bad as anorexia. It's just the opposite of anorexia, okay? So what are the symptoms of bulimia? Bulimia signs and symptoms may include being preoccupied with your body shape and weight, living in fear of gaining weight, repeated episodes of eating abnormally large amounts of food in one sitting, feeling a loss of control during binging, like you can't stop eating or can't control what you eat, forcing yourself to vomit or exercising too much to keep from gaining weight after binging, using laxatives, diuretics, or enzymes after eating when they're not needed. Fasting, restricting calories, or avoiding certain foods between binges, using dietary supplements or herbal products excessively for weight loss. The severity of bulimia is determined by the number of times a week that you purge, usually at least once a week for at least 3 months. Now, when should you see a doctor if you think you have bulimia? If you have any bulimia symptoms, seek medical help as soon as possible. If left untreated, bulimia can severely impact your health. Talk to your primary care provider or a mental health professional about your bulimia symptoms and feelings. If you're reluctant to seek treatment, confide in someone about what you're going through, whether it's a friend or a loved one, a teacher, a faith leader, or someone else you trust. He or she can help you take the first steps to get successful bulimia treatment. Okay, so what do we do if we know somebody or we think we know somebody that has bulimia? Well, I'm going to give you some things that you can do if you may know somebody that has bulimia. If you think a loved one may have symptoms of bulimia, have an open and honest discussion about your concerns. You can't force them to seek professional care, but you can offer encouragement and support, something I say all the time. You can also help find a qualified doctor or mental health professional. Make an appointment and even offer to go along with them. Because most people with bulimia are usually normal weight or slightly overweight, it may not be apparent to others that something is wrong. Red flags that family and friends may notice will include things like consistently worrying or complaining about being fat, having a distorted, excessively negative body image, repeatedly eating unusually large quantities of food in one sitting, especially foods the person would normally avoid, strict dieting or fasting after binge eating, not wanting to eat in public or in front of others, going to the bathroom right after eating, during meals, or for long periods of time, exercising too much, having sores, scars, or calluses on the knuckles or hands. And what they're talking about is right about here, and that's from people that have bulimia that force themselves to take their knuckles like this or their fingers to make themselves, purge the food. And that's why they have sores and things on their knuckles. Having damaged teeth and gums, because what happens with people with bulimia is just like anorexia. That food that they're eating is not getting to absorb any of the natural proteins and anything because they're trying to get it to come up because they're worrying about their weight before it can even be digested and used in the body. So that's bad. Changing weight, swelling in the hands and feet, facial and cheek swelling from enlarged glands. These are some of the things that it will cause. So you see it, and that's just a tip of the iceberg actually. If you have bulimia, it does affect a lot of your health. Now, what are the causes of bulimia? Well, the exact cause of bulimia is not known yet. Many factors could play a role in the development of eating disorders, including genetics, biology, keyword, emotional health, social expectations, and other issues. So we don't know what causes it. Are there any risk factors? Well, girls and women are more likely to have bulimia than boys and men are. Bulimia often begins in the late teens or early adulthood. Isn't it kind of strange how some of these disorders will affect more men and others will affect females more? It's strange. The factors that increase your risk for bulimia may include biology, which is people with first-degree relatives like siblings, parents, or children with an eating disorder may be more likely to develop an eating disorder, suggesting a possible genetic link. Being overweight as a child or teen may increase the risk. Psychological and emotional issues. Psychological and emotional problems such as depression, Anxiety disorders or substance use disorders are closely linked with eating disorders. People with bulimia may feel negatively about themselves. In some cases, traumatic events and environmental stress may be contributing factors. Dieting. People who diet are at risk of developing eating disorders. Many people with bulimia severely restrict calories between binge episodes, which may trigger an urge to again binge eat and then purge. Other triggers for binging can include stress, poor body self-image, food, and boredom. Are there any complications to bulimia? Well, bulimia may cause numerous serious and even life-threatening complications. Possible complications may include negative self-esteem and problems with relationships and social functioning, dehydration, which can lead to major medical problems such as a kidney failure, heart problems such as irregular heartbeat or heart failure, severe tooth decay and gum disease, absent or irregular periods in females, keyword digestive problems, anxiety, depression, personality disorders, or bipolar disorder, misuse of alcohol or drugs, in self-injury, suicidal thoughts, or suicide. So is there any way we can prevent bulimia? Well, although there's no sure way to prevent bulimia, you can steer someone toward healthier behavior or professional treatment before the situation worsens. Here's how you can help. Foster and reinforce a healthy body image in your children. No matter what their size or shape, help them build confidence in ways other than their appearance. Have regular, enjoyable family meals. Avoid talking about weight at home. Discourage dieting. And, of course, talk with primary care. Now, this is another reason why it is so important to see with the heart and not with the eyes. Because when we see somebody with our eye, we see maybe they're overweight. We're going to call them puffy. We're going to call them marshmallow. We're going to call them fat, obese. And that's going to lower their body image, especially if they're having a hard time trying to lose weight or their weight gain it has no control. There are some people that eat very little. They're not bulimic or anorexic, okay? They eat like normal good meals, but not a lot of junk food. But in their genetics, somewhere in the line, people are big. And it just goes down, just like cholesterol and a lot of other health issues that if it's in your genes, you have the risk of getting it. So we shouldn't go and, let our eyes overrun our mouth or, you know what I'm saying? When we see somebody that's overweight, we don't know the reason why. Medications can put weight on people. I have some friends back in New Hampshire that because of her mental illness, some of the medications they have her on, it makes her put on weight. Because a lot of the medications that are out there for mental illnesses, the anti-anxiety medicines and stuff, make it to where you just kind of zone out. So your body's not able to break down the fats and stuff, okay, the way they should, because you're not active. So it's kind of like eating a great big meal right before you go to bed. All them calories are not being broken down because the metabolism's not working, right? Well, with some of these medications that they have for, certain mental illnesses, that's on the same basis. It kind of stops it slows the metabolism down. So then when they eat normal, like what you and I would, they put on weight. So, there's many reasons why we shouldn't judge a book by the cover. It always, this is why we're learning more and more on why it's so important to learn to see with your heart and not your eyes. As I just explained to you before, just with bulimia, if you treat people and talk to them because of what you see with your eyes, you could be causing severe bulimia in them. But if you see from your heart and not your eye, you can catch this before it gets life-threatening. If you're a parent, you need to learn to see with your heart and not your eyes. If you have a friend, or an acquaintance, we need to learn to see with our hearts and not our eyes. No matter what the situation is, seeing with your heart and not your eyes applies to so many different areas in our life. And it affects so many different people besides ourselves. So I want to give you this personal message to each and every one of you out there, and I'm going to get close and personal with you. You all matter. We're all beautiful or handsome. Don't let people bring your self-image down just because they see with their eyes. Always remember, it's not the outside that makes you. It's what's in here, in the heart. That's what makes you. It doesn't matter whether you're skinny, fat, short, tall, yellow, green, purple polka dot. That's just a shell. It doesn't mean nothing. What really counts is what's here inside of you. And that's the way I look at you. If I want to reach out to anybody and everybody out there, if there is anybody that thinks they could be going through this, please reach out to me or somebody that can help you, whether it's your mental health worker or your primary care. Bulimia is not something to joke at. It's very serious and can be very life-threatening. If anybody out there knows of anybody with bulimia, please, I implore you, I really do. Use your heart. As hard as it is maybe for some, use your heart. Support them, encourage them, help them to get help, because some of these mental illnesses can be very debilitating, can be life-threatening, as you just heard, and nobody should be going through that alone. They need people to help encourage them instead of bringing their self-image down lower than what it is. Okay? So remember to always see with your heart and not your eyes. And remember, you out there, yes, you. Yep, you. You matter to me. I love you for the way you are. You're so beautiful on the inside because that's the way God made us. I don't look at you for your color of your skin, the clothes you wear, how tall you are, how short you are, how thin you are, or how fat you are. I don't care about that. I care about your heart, what's your inside, what you're made out of, your personality. You're a very special, unique person. And I love you for you. So until I see you all again, bye. Have a terrific day, everyone.